Well, you've got a problem and your doctor has a prescription. But if you need help with your eyes, chances are that prescription won't be enough to get the glasses you need.
No, it won't, because your doctor can tell you near or farsighted as different measures of your vision, but they cannot prescribe the right strength of lenses for you to wear, or at least the right fit. They won't work unless you have specific measurements like pupillary distance.
There are literally thousands of options for a new pair of prescription glasses. Frames for every face, dozens of brands, hundreds of styles. You need a doctor's prescription. But even with one, these glasses may do nothing to improve your vision, because that prescription is incomplete and likely won't include a critical measurement called pupillary distance, or PD.
Pupillary distance is basically where your center of vision is going to be in that lens. It's the distance where your center of the pupil is. Your glasses will not be correct without that pupillary distance.
Tara Matthews, a para-optometrist at Spartanburg Vision, specializes in getting the right frames to fit right.
Position them where you're going to wear, where they feel comfortable for you.
And it's usually someone like Tara, not a doctor, in charge of determining your PD.
That is the last measurement that I take, and I make sure and do it twice just to make sure.
The problem, as any glasses wearer knows, is that a new pair can be expensive, even with insurance. And unlike a prescription for a medication, you can't just shop around at an online pharmacy, even though there are dozens of online eyeglass retailers offering deep discounts. This prescription isn't complete without pupillary distance.
PD, the distance in millimeters.
Many sites feature instructional videos demonstrating ways to measure it at home. But it's not as precise as the one taken by the optician who's also trying to make a sale. And prices for glasses bought locally can run significantly higher than those found online.
I always start out with, well, let me tell you why that's not a good idea.
Scott Ligon's an optician at Jervy Eye Group in Greenville. He says patients hoping to hunt deals online ask him for PD measurements at least once a day. And Jervy will provide it for a $25 fee and a signed waiver saying you won't hold them responsible for the quality of your internet eyewear.
Best price may be online, but you're not getting the best quality.
Many upstate opticians will simply refuse to release the PD measurement at all, or only take it when making a sale. And the State Board of Opticianry won't help. When the issue came up in a meeting last May, they met with lawyers behind closed doors and decided they had no opinion at this time. In 2016, the state legislature took action on a similar eye care issue after low-cost computerized eye kiosks promised eye prescriptions in 10 minutes. Lawmakers passed a bill that made it illegal to get glasses without a prescription from a state-licensed optometrist or ophthalmologist. Governor Nikki Haley vetoed that bill. She wrote it would stifle competition for the benefit of a single industry because a small group of eye care professionals are seeking to block new technologies that expand low-cost access to vision corrective services. Lawmakers overrode that veto. Now, with no rule requiring opticians to release your pupillary distance, patients again have limited access to competition.
It seems intuitive if you didn't know the reasons that it's a risk. You would think, why not? Especially if I can save 50, 60, 70%.
Anthony Johnson's a pediatric ophthalmologist at Jervy Eye. He says it's not about the money or making a sale, because while online retailers only require a prescription and a horizontal measure of pupillary distance, the right fit, he says, requires other important details only an optician can provide. He demonstrated how other measurements that aren't included in an online order can be critically important.
Trying to custom fit the optical center of this lens you're custom making for each eye into the specific frame that fits onto that specific face. And the horizontal measurement is at least 10 times less important or 10 times less sensitive than a vertical measurement, and the vertical measurement is a complete guess.
Ligon claims nearly 90% of the patients who pay him for a PD measurement will come back with problems from an online order, asking him to make repairs.
They're almost never getting it right. The pupillary distance may be right, the prescription may be right, but that vertical measurement's wrong, or they have a prescription that just doesn't work for the frame.
And Tara Matthews, she remains a rarity. She and the doctors at Spartanburg Vision say they don't think you should shop online. But if you really want your PD information, you can have it.
Because ultimately that is their choice. This is their prescription.
You know, one of the strangest things about this story, about taking and sharing this single health measurement, is how few professionals were willing to talk about it. I called a dozen local opticians and optometrists, the chairman of the State Board of Opticianry and other board members. They either didn't return my calls or referred me to a state board spokesperson who again did not answer specific questions. In fact, only one board member agreed to an interview, but his employer, Prisma Health Upstate, refused to make him available once we told them what this story was about. This morning, Prisma Health did send us a statement, though, about pupillary distance. We'll put that on your screen here. It says, in part, many opticians are hesitant to provide adjunct information such as pupillary distance because they're concerned about possible harm that could be caused by glasses that are improperly fabricated. I put their whole statement online for people to read, Amy.
Well, this is an eye-opening report, Gordon, really. And talk about the online companies. Like, they must have something to say about this.
They did. And I of course, reached out to them, too. I talked to Zenni Optical. I talked to Warby Parker, two of the largest providers of these online glasses. In fact, if you Google buy glasses online, those would be a first couple of hits. Both of them indicated that, yes, that vertical measurement is extremely important, although they suggest that they're working on algorithms and other technology to try and get that better without having patients measure it themselves. Interestingly, Amy, Zenni, one of their arguments in this case is that the average price of glasses that they sell is about $40. So they suggest patients can actually have a little trial and error with them if it doesn't work properly.
Interesting. What a report, Gordon. Thank you.